Stein. I'm a licensed physical therapist. My practice is Squirrel Hill Physical Therapy. Today I'd like to demonstrate Graston Technique. This technique uses specifically designed metal instruments to address scar tissue and areas of restriction in the body. Each one of these instruments is specifically designed for various parts of the body. They're surgical grade stainless steel instruments. An emollient is used on the tissue so that the instruments can slide easier. This emollient has a beeswax base with some fragrance to it, and it allows the instruments to slide easier over the tissue. People think that you need to have surgery or a cut to create scar tissue. This really isn't the case. You can develop scar tissue by an excessive force going into the body. You can also get it by being punched, and then obviously you can get it tearing tissue. After the impact, in order to heal the tissue, the body lays down excess collagen in order to knit these tissues back together. Unfortunately, our body doesn't knit them in a clean-cut way. Scar tissue tends to be almost very much garbled, so that when we go to contract our muscle then, or we're putting force back into the body, this area doesn't have the flexibility to be able to contract properly. What I'm going to do today is that I'm going to just show you how I treat someone that has an area of restriction in the quadriceps muscle. The instrument that's used first to feel what is going on is this long instrument, and as I glide it over the tissue, I can actually feel areas of grittiness, and those are the areas that I really want to, and you can feel that right there, can't you?
I certainly can.
Those are the areas that I want to address whenever I'm getting into the more specific instruments. So I feel an area of grittiness right above his patella. He probably was playing sports one day and took a force into that caused some bleeding that led to those fibers being knit improperly. So then I take this instrument and I go over this area, and I basically brush or scrape it until I see reddening come up and until I feel the area start to smooth out. Now what happens with this is that I form reactive hyperemia, meaning I'm allowing more blood to go to this site as I'm smoothing it out. What then happens is his body will reabsorb this tissue that I have smoothed, and the muscle then will be able to contract in a more efficient way so that the person doesn't feel pain. Now what I do with this is that I watch the person's tolerance. It tends to be a painful technique. I'm very careful that I don't over-treat them, meaning I don't want to scrape away their skin, but you do have to go deep enough that you're actually affecting the tissue. So typically, after a session, a patient can be bruised, and I always inform the patient that that may happen. And you found that that happened in previous times that I treated you, right?
I have experienced some bruising. I've also experienced great relief.
Okay. And with the bruising, it wasn't so much that you were feeling pain with movement, it was more to touch.
Oh no, it was cosmetic really.
Right.
I could see bruising if I looked. I didn't feel bruising.
Mm-hmm. So I then can take another instrument and I can even go in a little bit more. This is more like a butter knife, and really concentrate now on maybe one area in particular. And boy, you can really feel that right there. The quadriceps muscle is such a common muscle to develop adhesions in. And it really responds well to this treatment. There's one other thing that you can do with this. Not only can you do it with the person static, but I also sometimes do it with them moving. Because remember, the muscle does move a joint whenever it contracts. So can you extend and flex your leg? So as they're doing that, I treat it both in an upward and downward movement, working on that gritty area. I have found in doing these techniques that I have been able to take my patients in places that I couldn't do with my hands. And as a physical therapist, I have found that sometimes your hands wear out and these don't. And so that's why I love Graston Technique. Great results with minimal pressure. As a physical therapist, I've been amazed at the results that I've been getting with Graston. In fact, some of my patients have even said it's miraculous. I highly recommend this technique. Thank you.